It is estimated that about 27 million Nigerians are living with disabilities, constituting about 15% of the Nigerian population. Advocacy groups say that people with disabilities constitute 1/3 of the country's poorest. And in terms of COVID-19, the World Health Organization says that persons with disabilities are more likely to experience extreme hardship due to the pandemic. To discuss with me on this, I have Barrister Theophilus Odaodu, who is a visually impaired lawyer and a disability advocate. Let's talk.
This is the COVID Law series. This is the COVID Law series.
How much of a concern is this COVID-19 pandemic to persons living with disability in Nigeria? Welcome to the COVID Law series. My name is Jake Okechukwu Efodu, and I'm joined here with Barrister Theophilus Odaodu. Welcome to the show.
Thank you very much.
So Theophilus, statistics show that about 27 million Nigerians are living with disability. That's almost 15% of the population. In fact, advocacy groups say that 1/3 of Nigeria's poorest constitute persons living with disability. And the WHO also mentioned that in this time of COVID-19, persons living with disabilities are disproportionately affected. So what does it mean? How has it been for a person living with disability surviving during this time of COVID?
Thank you very much, Jake. For persons with disabilities, COVID-19 means different things, and it affects persons with disabilities in diverse ways. And so when COVID-19 came, persons with disabilities were left behind. It shows clearly the gap that existed in the society in terms of policies, in terms of programming, in all that the government does, that persons with disabilities were left behind. So for persons with disabilities, COVID-19 is, let's say, an eye-opener to the public, to the government, to tell them that this thing that we've been talking about all along, that you are leaving us behind, this is what it meant. Mm-hmm. Not too many people understand it until the time for COVID.
So my statistics, they're pretty much just estimations, right? Because we don't really collect data on people living with disabilities in Nigeria, and that's already a fundamental problem.
Yes, that's what we all do. We give the estimate, base it on the WHO, 15% of population are supposed to be persons with disabilities. But then if I ask you what's the population of Nigeria, I'm sure you also get different figures. So because we are not sure of that figure, you cannot also put a figure on the number of persons with disabilities.
So in 2019, the Nigerian government passed Discrimination Against Persons with Disabilities Prohibition Act, and it was very widely celebrated. I know you were also an advocate for the bill at the time to become law, and when it passed, a lot of people were celebrating this as a win. Is there a way that this act has helped persons with disability in this time of COVID?
Though the signing of the bill into law was celebrated, the awareness about the act is very low. So not too many people, not too many establishments, both government and private, are aware of the act and its provisions. And so this act is yet to translate into policies or programs or any positive benefits for persons with disabilities. Recently, for instance, in March, when Nigeria got the first dose of COVID-19 vaccines, it did provide for people on the priority list, those that are to first get the vaccine. If you go back to that list now, you see that persons with disabilities are not on the list. They are not prioritized. But by the law and by the UN Convention on the Right of Persons with Disabilities, to which Nigeria is a signatory, persons with disabilities should have been prioritized. For instance, let's talk about access to information. when they start giving information about COVID-19 vaccines to the public, there was no sign language interpretation. And what that meant is that those who are deaf are not able to get any information that has been passed. And when they give jingles, they are not able to hear. And when you do video descriptions without a text description, the blind are not able to also get this information. For the deaf, a lot of them also lip read. And when you talk to them, they look at you and lip read. So if your mouth is covered, it's difficult to do that. So communication becomes difficult. When you talk about social distancing, it doesn't work for everyone, because for the blind person that needs a guide, how does he social distance? And for those who use wheelchairs, for example, sometimes someone will have to wheel them. Different people touch their facilities at different points, trying to give one assistance or the other. So when they give out all these measures, they fail to also give awareness on how persons with disabilities can stay safe, despite the fact that some of these measures do not fit. They are not possible with their disability.
What needs to be done to ensure that access to vaccines, access to Medicare, access to sanitizers, face masks can reach persons with disabilities?
Yeah, so a lot, like I said, first is awareness about the law and what it means for persons with disabilities, what it means for service providers, and even for the government. And steps have been taken in that regard by the various organizations of persons with disabilities. At least I'm aware that some of them have received funding to start this awareness and get the service providers to begin to prioritize persons with disabilities. Of course, litigation could be one of the ways which is also provided in the law, because any form of discrimination is stated as a crime. And the government has set up the Disability Commission, the Disability Persons with Disabilities Commission, which is supposed to now enforce the law. But the commission is still crawling. It has not done so much in this regard. And if you check, you will see that disability and poverty work hand in hand. So a lot of the people that are directly affected by these are not even able to hire the services of lawyers, to talk of instituting action, and then the slow pace of litigation. So these are some of the things that are being considered why focus is on advocacy and trying to create awareness instead of litigation for a start. But I'm also seeing that in the nearest future, when things are not changing, perhaps litigation will be one of the ways to go, so we can test the law and also get judicial pronouncement on the provisions of the Act.
So before and now, during the COVID-19 pandemic, how has life been for you?
It's been okay for me, and that's because I am privileged to be working with an organization that did recognize what I have to offer and are able to give all the necessary support. But that's not the case for millions of persons with disabilities out there, struggling to make ends meet, working with the government and other private sector that did not actually put into consideration their peculiarities and give necessary support to make them perform on the job.
Thank you very much, Barrister Theophilus, for sharing those brilliant insights with us. Before you leave, I would ask you, what is one thing, I know there are so many things, but what would be one priority thing you think we need to do for persons living with disabilities in this time of the COVID-19 pandemic? Well, I know there's so many, but I'm just wondering, what would be reasonable, achievable in the immediate time frame that we have right now?
Yeah, what I would say could help is that even as we work in the third phase of COVID or do the post-COVID-19 recovery plan, persons with disabilities should be prioritized. Like when you say this should happen, we should first look at how is it possible for persons with disabilities to benefit. What can be done, what modifications can be provided. Because when we give out policies or regulations and there are no measures put in place for persons with disabilities, then they are definitely left behind. So I would like to see a situation where the leave no one behind is not just a mantra, but an action statement.
Have you gotten vaccinated?
Yes, I have.
Okay.
I have the first and second dose.
First and second dose, that's good. Well done. And how did you access the location?
Well, I don't have much of mobility challenge, so I was able to walk into the hospital and get vaccinated.
All right.
Yeah.
Thank you very much for contributing with us right here on the COVID Law series. And thanks, Theophilus, for the great work that you do for
My
the disability
pleasure.
community.
Thank you so much for this opportunity, Jake. And I do hope that the right people will listen.
Oh, they have to.
Thank you.
My brother, my sister, papa, mama, and pikin. Corona, no big pass us. We go fight time, we go win. As long as we remember to always do the right thing. Wash your hands, love each other, we go win. Oh. Corona, na the virus, we dey worry human being. E no get Lego, but e dey waka from person to person. But we fit beat am, we fit stop am if we maintain good hygiene and practice social distancing. We go win. Oh. No shaking hands with your neighbor. Blow them a kiss from afar. Use soap and water to wage war. Let's show this thing who we are. We are special, we're courageous, we are awesome human beings. We dey super, we get power, we can conquer anything. If we hear word and obey laws and exercise discipline. Wash your hands, love each other, we go win. Oh. If it be like say you know well, like it's something they do you, and you feel say, you believe say, you get to see they do you, and your body no researchy, like it's something they do you. No let panic finish you, you go win. Oh. Self-isolate for the sake of all the people that you love. Oh, don't go around spreading rumors, 'cause fake news won't help anyone. You are special, you're courageous, you're a caged human being. You too much, oh, you get power, you can conquer anything. Only if you hear word and obey laws and exercise discipline. Wash your hands, love one another, we go, we know. My brother, my sister, papa, mama, and pikin. COVID-19, no big pass, we go fight and we go win. Just as long as we remember to always do the right thing. Wash your hands, love each other, we go win. Oh.
Very important song from Cobham's Asukwo, the blind music icon. And he's actually right. We go win only if you sanitize, if you wear a mask, you social distance, and of course, you get the vaccine. It's been a great time on the COVID Law series, and I hope you heard from the experts themselves. We need to collect more data around persons living with disabilities. Persons with disabilities need to be prioritized in this time of COVID-19. And in case you didn't know that the Discrimination Against Persons with Disabilities Prohibition Act is now law, now you know, and you should get to read it. All right? Send us your questions, contributions, and comments. Use the hashtag COVID Law series. Like, share, comment, and subscribe. All right, to the next episode. Have a good one.